Hi, Rob here from injuryfitpro.com. This is another episode from my back pain decoded series, and on today's video we're going to be focusing on facet joint pain as a cause of low back pain. And amongst other things, I'll be covering some of the options when it comes to facet joint treatments, and I'll also be giving you some of my top tips for treating your own facet joint pain. In terms of facet joint pain, it's commonly felt as localized pain either to one side or the other of the spine. It might have a little bit of a spread out around into the buttocks, but doesn't usually go that far down the legs and doesn't include things like pins and needles or numbness or weakness in the legs that you might get if there was a trapped nerve because of, most commonly because of a disc protrusion or disc prolapse. Now, whilst it's not exclusive to facet joint pain, one of the common features of facet pain, in the lower back at least, is that pain that is brought on by extending or arching backwards, and particularly if you go arching backwards and to the side of the pain, or to the side of where the facet joint has an injury or is degenerate, that will often reproduce that localized pain over that side of the spine, indicating that that facet joint has got a problem with it. Some people find yoga and stretches to be helpful as it opens up the facet joints if they're degenerate. It's important to do that and be careful with doing that if you have got a slipped disc as well, because that can sometimes be a contraindication to some of those stretches. However, in the absence of that, things like hugging your knees up to the chest can be useful for somebody with a slightly degenerative lower back, provided, as I say, they haven't got too much of a disc issue. But often what you'll find is people will hug their knees to their chest and grip in front of their knees, but my top tip there really is to grip behind the back of the knees, because you get a much more powerful stretch and open up the lower back much better that way. Similarly, in yoga, the cat stretch, the problem with that is that sometimes the movement maximally goes through the middle back, not perhaps where the lower back is and where you want to really get the stretch. So my top tip on that one is to do a modified kind of flexion maneuver with, or pelvic tilt really, with the lower back, but from a sideline position whilst you're feeling the individual vertebrae in the spine. So you want to set yourself up into a position where you're lying on your side and you're going to be feeling these little spaces in between the knobbly bits of bone in your back. And as you tilt the pelvis forward, you want to be able to feel those opening up on the individual segments, particularly on the segment where you have the pain with. So if you're an L5-S1 facet joint, that's really where you want to be aiming for, and really feel that those areas are opening up on the lower back. Okay, just to whiz through some of the options when it comes to facet joint pain treatment, starting at the top with the least invasive first, you've got your manual therapies, so things like acupuncture or medical acupuncture, dry needling as it's sometimes called, deep massage, manipulation, so visiting a chiropractor or an osteopath, which tends to work quite well for acute situations and facet locks. Shockwave therapy is something that's starting to emerge, and there's some increasing evidence to show that that can work quite well for facet joint inflammation. Okay, then on injections, most commonly these will be steroid injections coupled with local anaesthetic. That's come under quite some criticism in the UK recently and has been criticised really for not being worthwhile. However, I think personally that the problem is it's been overused in the past and maybe not used on people who have got genuine facet joint pain, which is why it has mixed results. I've personally seen this can work quite well. It's important to realise that this doesn't provide a long-term relief, but it does give a window of opportunity and a window of relative pain-free time where the patient can help to rehabilitate themselves and do more exercise and improve their posture, lose weight, that sort of stuff. Denervation is a particular procedure that involves basically radio frequency denervation, which is basically trying to stop the nerves from sending signals to the facet joint, so a way of numbing those nerves without actually injecting anything. It stuns the nerves basically. Stem cells is something that will probably be emerging in the future as something that will be used more and more in the future, I would say, to help as part of regenerative medicine. There is surgery that can be done for facet joint pain when it's really bad, so things like decompression and facetectomy, where the surgeons are removing part or whole of the diseased facet joint if it's really arthritic. And even some specialist surgeons are doing facet joint replacements these days, so that's another thing that might be worth investigating and doing some research on and do some searches for. Do tune into my other videos where I'll be covering some of this stuff in more depth, particularly the injections. On the injections video, there's some really important information I need to share with you about the different types of injections and stuff that you would need to be aware of if you're going to go for injections, particularly the standard steroid injections, and how the surgeon actually performs that, or how the pain doctor actually performs those. So there we go. Hope you enjoyed this video on facet joint pain. If you want more information on some of the topics I've covered in this video, such as the injections and some of the scans that I've touched on, you can find that and a load of more information in my book called Back Pain Decoded, available on Amazon and also from my website. Please do check out some of the links below. I'll be posting some links to some of the other related videos to this one. And also please let me know your comments. It'd be great to know what you thought of this video, and don't forget to subscribe. Click on the links below.